The intention of this video is to give you a press and play, follow along workout that you can do that is going to hit every little piece that is making up this big picture. Rather than me writing down 20 different exercises with sets and reps and instructions, I feel like this is the easiest way. You don't need any equipment except for your body, and then just something to put your feet on to start off while we're breathing. So like an ottoman, a couch, just anything that replicates the position that I'm in. So start lying on your back. Maybe like a stick or something. I'm gonna grab my stick. If you have yours, grab that too. Okay, so start lying on your back with your knees on, or your legs up, or whatever it is. You want to make sure that it's supported enough that you can just chill and don't have to worry about like tensing up, like to keep your legs from falling off. So we're going to go one hand on the heart, one hand on the belly. Now this is just to help guide your breath. You're improving your diaphragmatic breathing a lot, so if you feel like you've got it, then you can just go palms up, shoulders down. That's going to help the chest open up a little bit more than holding these shoulders in internal rotation. So we're just going to start with 10 regular breaths into the belly. So not any deeper than what you normally do. I'm going to do it with you, 10, and then we'll move on. So in and out through the nose, filling the belly, exhale, let it fall. After your 10, we're going to do 5 more, where we take in, I want you to fill your belly with air, pause, fill in some more air all the way to the top of your lungs, as much air as you can possibly fill in, and then exhale it all out. So belly first, chest, pause, and then exhale. 4 more. Three more. Counting, just to kind of give you an idea of how long it's taking me. Not that I'm a master of breathing at all, but just something to reference. One more belly and then chest. All right, let's go arms overhead. We're just gonna chill here and work on moving our spine, our pelvis, and our rib cage as we breathe. So, if you're watching the video, watch my lower back. Inhale, I'm gonna let the rib cage pop up. Create space in your lower back. You're still going to push your belly out, and then as you exhale, you're going to close that space, push the lower back down, pull the rib cage down, and kind of tighten up your stomach. Again, inhale. Tilt your pelvis forward. Imagine you're sticking your butt out. You're going to create a little arch in your lower back. The rib cage is going to pop up, and then exhale, push it down. 3 more. Inhale, lift. Exhale, push down. Okay, one more exercise here, laying on your back. Grab your stick. Maybe a couple more. Okay, the only thing you're going to do here is move your shoulder blades. So we're going to reach the stick up towards the ceiling. So this is protraction of the shoulder blades. We're increasing the distance between our shoulder blades and our spine. You don't reach so far that you feel a strain in your neck. Just get those shoulders off the floor and then pull them back down. So punch both hands up and then pull it back down. I don't want you to do this where every time you move, right, you're popping the rib cage and moving your spine. Keep your lower back pressed down, arms up and down. Forward, pull back. When we push forward, we're using our serratus, pulling back, the middle trap and the rhomboids, both really important muscles of the scapula, the shoulder blade, that assist in movement and posture. Okay, reach up, and then we're going to take that back overhead. Now what I want you to focus on here is as you reach back, pressing the lower back into the floor. This is something that I pointed out when you were doing the rows when you were standing with the band. And the coordination wasn't quite there because when you're standing, it's a lot more challenging. So when you're on the floor, you can have that input and really dissociate what's going on with the spine from the shoulders, which is also really important when we get to higher level exercise. So push the lower back into the floor, reach the stick back, and then we're gonna inhale back up so we can coordinate our breath. So inhale, stick comes up. Exhale, push your lower back down, tighten up your abs. Your rib cage shouldn't pop up, arms go overhead. So when I say rib cage shouldn't pop up, if I take my fingers here and I try to kind of hook under the rib cage, I can't. My abdominals are pulling the ribs down as opposed to, here I can kind of hook my fingers underneath. So arms go back, ribs come down. Do 5 more. Inhale, exhale. 2 more. Okay, ditch the stick, flip it over to your hands and knees. Okay, so first thing you're going to do is sit back on your heels and bring your hands kind of like 5 to 6 inches in front of your knees, and we're just going to work on a cat-cow from this position. So push the chest forward, squeeze the shoulder blades together, lift the chin. And when you exhale, I want you to really push into the floor, create a little bit of traction here, and try to puff your back out as much as you can, chin to chest. It's almost like you're trying to stick your spine out through your skin. That's how hard you're pushing. Good. Chest forward, squeeze the shoulder blades together, lift your chin, inhale. Exhale, puff out the back, chin to chest. 2 more. Inhale. Exhale. Inhale. Exhale. Okay, now from this position, we're going to find somewhere neutral. A little bit of butt out, chest up, and then walk your hands forward about 6 inches. Now, all I want you to do is squeeze your butt muscles. Squeeze and then relax. Squeeze, relax. The next time you squeeze, you're going to use that contraction to push your hips forward into a tabletop position. Relax and let the hips come back down to the feet. Squeeze your butt muscles, rock it forward, relax, and come back down. Keep going at your own pace. This is one of those that I give to a lot of patients with lower back pain that stems from glute weakness, and surprisingly, I would say at least more than 50% of people say, I don't know if I'm squeezing my butt. So, if you're like, yes, I'm rock solid, I know I'm squeezing my butt, awesome, do it anyway, keep going. This is a really good decompressive position for the lower back. If you're struggling, you're certainly not alone. The more you do it, the better connection you'll get to these muscles. Just pop it up and down. Okay, next time, rock forward, separate the feet. Bring the feet back together, rock back. Squeeze your butt, rock forward, separate the feet, hip internal rotation. Feet touch, rock back. You're getting it all, Leanne. We're not letting any missing piece fall behind. I anticipate this taking about 20 minutes. Honestly, I don't know. I want it to be comprehensive. If it's way too long, I'll just record another one tomorrow that's a little bit more short, condensed if it ends up being too long. Okay, hands and knees, tabletop. Let's get a couple cat-cow in here. Now we got a full range spine. Inhale, arch, look up. Exhale, round. I did not mention in the beginning, but if anything gives you pain in the moment, if it's between a 0 and 3 out of 10, kind of work through it, maybe back off a little bit. If anything starts to aggravate pain above a 4 out of 10, just move on. Wait for me to stop jabbering and move on to the next thing. Okay, lay down on your side. These are your rotations, so I'm going to ditch that. If you need to change locations, you can. Okay, arm stack. So let's do 5 of the rotations. Oh, this is my favorite. We are going to use a wall at some point here, so just keep that in mind. If you don't have an open wall in whatever room you're in, either relocate or, I'm not sure, we'll have to figure out something else. Okay, on this last one here, we're just gonna pause and breathe. So sometimes what I like to do is take this hand and hold the knee down if I feel like it's popping up. And I just want you to take 5 deep breaths in this position. Take that left arm and just creep it up a little bit. Think about that clock. So maybe reach towards like, either 10 or 2, however you want to view the clock. It's not straight out to the side, but it's kind of like a diagonal. Here, I get a really good pec stretch. Okay, we're going to take it up a little bit higher. Still keep that palm facing up. If your shoulder is extremely uncomfortable, you can play around with the rotation. Mine actually doesn't feel great right here. If I go thumb up, I feel a bit better. One more breath. And now let's do our circles. 5. I really hope my phone doesn't die. When I started this video, I had 27%, so fingers crossed. Actually, this is my 3rd take doing this because the first 2 takes was when Dixie was here and she went absolutely bananas with me on the floor trying to attack me and play. So she's not here. Okay, other side. 5 rotations. Just do the regular ones first. Oh. Bring it back. this actually works out perfect. I signed up to go to yoga tonight, and then I forgot that I had laser hair removal, and you're not supposed to sweat or wear deodorant. So going to hot yoga would have been not a good time, probably later tonight. So I'm glad I'm doing this with you now. Okay, last one. Open it up. And I put the hand on the knee. Slide that arm up a little bit. Think about the diagonal. Keep doing those deep belly breaths. Maybe up a little bit higher. And circles. Okay, roll it onto your stomach. And we're just going to go what's called prone on elbows. I guess it's often referred to as Sphinx pose, where the elbows are underneath your shoulders and the palms are down. And I just want you to kind of squeeze your shoulder blades back and look up. Okay, lower all the way down to your stomach. We're going to put those fingertips just underneath the shoulders. And everything always starts here with the shoulder blades. There's shoulder blades back and down, and then press your hands into the floor for a little baby cobra lift up, and then back down. Let's do 5. So press and lift, keeping the shoulders away from the ears. We got about 50% of the back muscles working, 50% of the arms. I do not have a towel roll. You'll see me kind of lift my head up here, but for these next exercises, if you want to roll up a towel and put it underneath your forehead, that can be a little bit more comfortable as we move on. Okay, arms down by your side. This is one of your pieces of homework. We're going to go palms facing down. Squeeze the shoulder blades together, lift up, externally rotate. We got 5 reps. Okay, forehead stays down for this one. We're going to go arms out to the side, thumbs up, pinky down, and just squeeze the shoulder blades together and lift. We want to try to stay at about this 180-degree T formation. Good, squeeze and lift. If you need to take a break, do so. One more time. Good, and push it back into child's pose. In child's pose, we're actually going to hang out here for a little bit. I want you to focus on breathing in a different way. I mean, it's the same style of breath, but we're just going to think about where we're putting the breath a little bit differently. So instead of expanding your stomach, I want you to think about expanding your back. Thinking about taking these ribs and really just pushing into them. So arms can be anywhere that's comfortable. Really deep inhale. And make that rib cage get as big as you possibly can. And then exhale. One more breath. Inhale so much air that you feel the back muscles stretch. Okay, return to your back. We're going to do a core exercise here. So this is called a dead bug. The goal of this dead bug is to keep your lower back imprinted into the floor the whole time. So if it becomes strenuous where you feel like you're arching, I will show you a regression, and then always go back to that regression if you can't do the original exercise, keeping the lower back down. So we're gonna stack the knees over the hips with the arms up towards the ceiling. Left leg is going to go out, right arm overhead, bring it back to the center. Okay. Right arm, left leg, keeping that lower back down. Left arm, right leg, keep the lower back down. Okay, your regression is to take the arms out of it. You can just chill with the arms. It's almost kind of helpful sometimes to put them on your stomach so you can feel that the rib cage is down. And then you're just gonna tap your feet, alternating back and forth, trying to keep, the whole goal here is to not let the ribs pop and to keep the lower back down. But if you were good with the dead bug, all right, pause, hug your knees into your chest. Cross the right ankle on the left knee, arms out to the side, and then let both knees fall over to the right. Back to the center. Left ankle on the right knee. Let the legs fall over to the left. Back to that dead bug position, whichever variation works best for you. 4 reps on each side for 8 total. Flip it back into your tabletop position. I'm going to face you, hands and knees. We're going to take the left leg out to the side. I'm going to go opposite since I'm facing you, so I'm pretty much like a mirror. Rock the hips back, stretching out that inner groin. Keep the leg where it's at. We're going to stack the shoulders over the hips. Come on up. And then take this right hand down on the floor beside you, left arm up towards the ceiling. Keep this foot grounded to the outer edge towards the pinky toe. And then we're going to take this arm overhead. And I want you to push into the floor as you reach. We're going to open up this entire side body. You want to increase the distance between your hip and your rib cage and really just open that up. We're going to stay here and take 2 deep belly breaths. And let's switch. So we're going to take this hand, slide it down the leg, take the right arm up and overhead. Now we're increasing the distance between this hip and this rib cage. Switch. 2 on each side. Back to your tabletop. Take the left leg, stick it out to the side, and rock back. You bring it up. Left hand is going to go down, right arm overhead. Really stretch and reach, fingertip to toe. Open up the side body. Deep belly breath. And switch. Right hand down the leg, left arm up. Okay, stand up. I'm just going to check the screen, see how we're doing on battery. Oh boy, are we still rolling? We have a low battery. Okay, that's 25 minutes. I'm gonna stop it and then I'll make you another video. Be back with more.